Good morning. This is Emily Henderson, pharmacist with the Kentucky Hospital Association, and I am joined by my pharmacist colleague, Mary Beth Ekin. Thank you so much for joining today's Kentucky Statewide Opioid Stewardship Program's Emergency Department Bridge Program webinar entitled Help the Helper, Boundaries and Empowerment for Peer Support Specialists. If you haven't already, please mute your phone lines. If you do have questions during the presentation today, by all means, please utilize the chat box, and our presenter today, Brook West, will address those as she's able. Also, there will be time at the conclusion of her presentation where you can type in the chat box or unmute your line and ask Brook directly questions you may have. This webinar is being recorded, and it will be posted to the Kentucky SOS website within a week or so. So I did put the Kentucky SOS website address in your chat box. If you have not checked it out, please go and look for references, resources, and toolkits, plus past webinars are posted on the website as well. Just lots of information, useful information for you and your patients as well. So again, thank you so much for joining the Kentucky Statewide Opioid Stewardship Program webinar this morning. Kentucky SOS has the honor of having Brook West back again to present to our group and to help educate today. And this is a very important topic, not only for our peer support specialists, but for all of us in general as clinicians. And so we do welcome Brook West. She is from Voices of Hope in Lexington, and Kentucky SOS welcomes Brook West. Thank you so much for being with us again today. And Brook, please, we look forward to learning alongside you today.
Thank you so much, Emily and Mary Beth, for having me back to talk about boundaries. And you're right, this is a topic that really anyone can benefit from. So yeah, my name is Brook West. I'm the Training and Education Manager at Voices of Hope, and I'm also a person in recovery. And Voices of Hope, for anyone who doesn't know, is a recovery community organization. In Lexington, Kentucky, we have our Recovery Community Center is located at 644 North Broadway, but we have other recovery coaches embedded in partner agencies across the state, which is really cool. We help participants. We try to empower them to identify and pursue their goals to help support their recovery. So this I don't know if I just froze. Sorry, I just got a flash from my Wi-Fi. Hopefully everything's okay. It looks like it's back, but anyway, this is the second half of the presentation that I started in December. So welcome to 2026, everybody. I hope you had a good New Year holiday stretch. And so the first half of this presentation was about self-care. I'll do a little review of that, but then we'll be getting into the boundaries and empowerment and self-advocacy piece for peer support specialists. Before I go any further, let me acknowledge our funding statement. This work is supported by the CDC's Overdose to Action grant through a partnership between Voices of Hope and the Kentucky Injury Prevention and Research Center. And our learning objectives today are to describe what your role is and is not as a peer support specialist, explain one example of setting a boundary as a peer support specialist, and to describe self-advocacy. So just to review a little bit where we left off last month talking about self-care and emphasizing that self-care is not selfish, because how we care for ourselves impacts how we care for others. And we talked about self-care as harm reduction. And if we think about the point of view of our participants, clients, patients, whatever field you're in, whatever word you use, the people that we're serving are vulnerable, and they are coming to us for a service. They're coming to us for help, for support, for assistance. And if they are met by us and we are irritable, not taking care of ourselves, if we're not prepared, inconsistent, that impacts their experience of the services. It could be re-traumatizing, and we can end up being another thing that our participants have to overcome in the journey of their recovery. And we don't want that. It's so important to care for ourselves, self-care. We have an ethical obligation to care for ourselves. And so building a self-care practice, we talked last time, and I'm just going to go over this really quickly, a self-care practice that spans over the different domains, 6 domains in our lives, because we experience lives in different areas. We have our home lives, our work lives, our social lives. But these 6 domains are physical, emotional, mental, spiritual, social, and professional. And how important it is to identify things we can do to care for ourselves across all domains to build this self-care practice. And so the physical self-care refers to self-care practices of the physical body. And emotional self-care are self-care activities that help us care for our emotional lives, like developing healthy coping skills, setting limits and maintaining boundaries, which is what we'll be talking about for most of our time today. Make time for yourself, do intentional activities, and using the same tools we offer our participants, which is really hard, sometimes to take our own advice. And mental self-care, there's some overlap here with emotional self-care, but these are things that help us care for our mind. Things like self-reflection, self-awareness, therapy if you need it, taking time off, intentional screen breaks, which is always the one that I really need to do better at, self-expression, following your curiosity, puzzles, playing games. And then the other 3 domains are spiritual self-care, and this does not have to be religious. It could be, but it could be anything. Spending time in nature, prayer, meditation, reflecting on your meaning and purpose. Social self-care are how you care for the relationships in your life, and this is another one where boundaries are really important. And then professional self-care. How are you taking care of yourself at work? How are you managing your time? How are you prioritizing your tasks? Are you taking regular workday breaks and vacations? And then the workplace boundaries, which is what we're about to talk about, and as well as self-advocacy. And it's important to note that most of the things mentioned here as examples across these domains do not cost money. I think there is this belief that self-care is expensive or I can't afford self-care, but there are daily practices that you can incorporate into your life that come at very little cost, if no cost. When I think about how important it is that I journal, that I meditate, I'm able to do those, and they don't cost me anything, I guess, except for the paper and pen. But to me, we're talking about pennies here. So into the boundaries discussion, and there will be opportunities to participate. I'm going to be asking the group questions. I would love to hear from you in the chat when we get to those points, or at any time if you have a question. I'm monitoring the chat, and but if I miss something, Mary Beth or Emily can jump in and make sure I don't miss any of your questions. So it's important to know that boundaries are self-care. Boundaries are the lines we draw for ourselves to know what is acceptable and unacceptable in alignment with our values, beliefs, and sense of safety. And last time we talked about how self-reflection is such an important part of self-care, and you have to self-reflect in order to know what your values, beliefs, what safety means to you. And so once you have to do that reflection work, you have to know what's important to you in order to know where the lines are, these boundary lines. And they're really important. Boundaries are so important for so many things. One being self-preservation and safety. And this was major for my growth and sustaining my own recovery. Just thinking about things in terms of safety. One example that comes to mind was I was in a recovery residence, and I'd been there for a few weeks, and I was getting close with some of the women who lived there. But one of them, I mean, I didn't know her very well, but I felt really bad for her because she got kicked out of the house for a curfew issue. And it just seemed a little bit of like an extreme consequence considering the situation. And a few days after she had left, she was at a house in Mount Sterling and called me in the night to pick her up and bring her to Lexington. And I just felt bad for her. And I was the only one that she knew with a car. And I drove out there. And when I pulled up to the house, there was, clothes all over the yard. She was yelling with the person who was in the house. And I just had that sense of like, oh, this isn't safe. But it took up to that point for me to recognize that this wasn't a situation I wanted to be in. And I ended up giving her a ride to Lexington. She met up with some other friends, and nothing happened. A couple days later, she was arrested on some weapons charges. And so I might have unknowingly transported her and weapons. I don't know. But I think about that as someone, I was about 8 weeks or so into recovery, and I was not thinking about my safety at all. And I wasn't thinking about my boundaries. Like, I'm not comfortable with, driving people I don't really know, or driving to an unfamiliar place at night when no one else knew where I was. So yeah, that's just a big example for me in my early recovery. Boundaries are also important for reducing stress. It would have been a lot less stressful if I'd had some boundaries in place during that situation. Having healthy relationships, improving self-esteem. If I'm doing things that are safe for me and I do them consistently, I start to feel better about myself. And also knowing what your boundaries are is how you can communicate your boundaries, which helps you advocate for your needs. And we'll get into the self-advocacy piece in a little bit. And we want to think about boundaries in kind of like three general ways: as porous, healthy, and rigid. So we'll start here on the left with the porous boundaries. And these are boundaries that have a lot of holes in them. The good and the bad can both, get in freely. And these are people who just can't say no. These are the people pleasers and really conflict avoidant. Will just give in to other people. They'll say things like, I'm always available for my team. I'll do anything to help. There seems to be like no limit on what they'll do. They don't advocate for their own values. And this is consistent with a passive communication style, which we'll get to later on in the presentation. I'm going to skip over healthy for now and go to the rigid boundaries, which is this solid line, boundary where no good, no bad is getting in. And these are people who often say no. They're not flexible at all. They avoid conflict by pushing away others. No tendency to really compromise, and they just ignore what other people say. They're often aggressive communicators, and they'll say things like, don't even think about talking to me outside of the office. They draw these really hard lines. That's an example of boundaries. And then healthy boundaries is what we're going for, where we can say no when needed, and we have our values that we can communicate and share. And however, we can still be open-minded to new information. We can adapt to other opinions and just kind of consider another point of view and change as needed. And this is associated with assertive communication. And an example of a healthy boundary is I will not respond to work calls on the weekend. So we're going to be talking mostly about workplace boundaries, but just some quick examples of personal boundaries, which are these lines and limits you create between yourself and other people. And those are things like, we can text daily, but I do not want to text every hour. Or do not post pictures of me on social media without my permission. We can meet for dinner, but I will drive separately so I can leave when I want. And so the workplace boundaries, these are the lines and limits within a job role and your relationship to the job. And these examples are, I will not transport a client because I am not an authorized driver. You may have my office phone number, but not my personal phone number. You may email or call me, but I will not join the unofficial group chat. And yeah, that one's straight from my lived experience. I will not. Where there's a Facebook Messenger at work that a lot of people participate in, and I can't do it. I can't do all those notifications. And sometimes they learned early on how to find me to get like the $3 contribution for the birthday cake or whatever the office thing is. So yeah, it's healthy for me though to not be involved in the big unofficial group chat. So if you're here today and you're a peer support specialist or recovery coach or care navigator, there's lots of terms for it, and you're wondering what are your boundaries in the workplace, I want you to know that it's unclear and confusing because like I was setting this up, there's multiple job titles for the work that you do. Being a person with lived experience of substance use disorder or mental health recovery, helping others who are in and seeking that recovery support. This research group did a systematic review of peer delivery recovery support services for addiction across the United States. And I'm not going to read all of this, but the gist is that there was just no consistent definition for what a peer worker is. And there was such variation from state to state, organization to organization, different training requirements, that it's just really hard to know what your workplace expectations are because there's no nationally recognized set guideline for the work that you're doing. But there is a place where you can start to learn about your workplace boundaries and what's expected of you and where those lines and limits are. And that involves knowing your resources. First thing to know is your job description. Do you know what your job description is, what's expected of you? And then the employee handbook. Have you read it? Do you know how to find it? Have they maybe done updates that you're not aware of? But know how to locate the employee handbook and then to read it, to know what are the rules at your workplace, and know any other additional workplace policies or standard operating procedures around your job tasks. Know the chain of command. Who do you report to? What's the expectation for communication, and what's the expectation for documentation? And legal compliance, HIPAA, 42 CFR Part 2, mandatory reporting. Know those procedures around confidentiality and what documents are required. And if you don't know, ask for help. Don't guess on any of this stuff. And then understanding the peer support role, it's important to know what you're supposed to be doing and what you're not doing in your role. And so this is from SAMHSA. I adapted this chart from their materials. And so a peer support is a person in recovery sharing their lived experience. They're a role model for recovery, demonstrating positive recovery behaviors, the role model for the transformative power of recovery. You help connect participants to resources, help them with their goals. A peer support is not a professional. And I mean professional in the context of being, licensed to diagnose or treat substance use disorder or mental illness. And you do not give professional advice along those lines. And you're not considered an expert or an authority figure. You don't see the person as a case or diagnosis. You don't motivate through fear or through negative consequences. You don't see them as a case. It's not someone that you treat. You don't diagnose them. And so it's important to know this boundary line, especially that a peer support specialist is not a sponsor, not a therapist or counselor, not a nurse physician, not a lawyer, priest, clergy, or a family member. And what we tell our recovery coaches at Voices of Hope is that this is a conversation you need to have with your participant the first time that you meet with them, so they understand what your role is. And you might have to remind them, over and over. I think the ones that get probably confused the most are being a sponsor. People think being a recovery coach or being peer support is like having a sponsor, and that's not the role. Or being a family member, especially participants, when they feel like they have no one else, and they can really get attached to their recovery coach. That boundary lines can they can get blurry in the eyes of the participant, and it's up to the recovery coach to draw those lines and maintain that boundary line. So workplace boundaries becomes this blend of knowing what your job duties are, what's expected of you in your work, what's the company policy, what are the rules of the place where you work, the legal compliance, what's involved there, what paperwork's involved, what are those rules, and then also self-disclosure. Does anyone know what self-disclosure means? And if you could, put that in the chat. What does self-disclosure mean? Yes, revealing personal info. Thank you so much, Patrick. Good to see you again, by the way. Yeah, revealing. Yeah, revealing your personal. Yeah, you're revealing your personal information. Yeah, self-disclosure. What do you share about your personal life? And there are pros and cons to this. Sharing about your personal life, and this is really hard for, peer support workers, because we are expected to use our lived experience and our story, to help the other person, to help demonstrate, the transformative power of recovery, to transmit hope to others. And so, on the plus side of self-disclosure, it builds trust, rapport, team building, and you can come across as, you're being authentic. But there's also kind of a shadow side to self-disclosure, and it can be the oversharing, trauma dumping. It can diminish trust. An example of this one for me is, man, and I hate to admit it, but it's just a fact of my lived experience, is that at a job prior to entering recovery, I stole money from the tip jar. I stole cash from the tip jar. Not proud of it, but I did it. And so that's something I knew. I mean, that's something I did. And I came into recovery not wanting to do that anymore, trying to establish some values and principles for myself. And I knew that was not healthy behavior. It just didn't even feel like me, that's not, I couldn't believe it's something that I had done in the past. But my first job in recovery was actually at a Panera, and I am, they get me on the cash register. I make the transaction, and the cash, they hand me the cash, and the cash register pops open. And what if I had turned to my coworker and said, I can't believe you guys are letting me handle cash because I totally stole from my last job. That is a self-disclosure that would have diminished trust. They would have been looking at me concerned, not thinking that they could trust me on the cash register if I had overshared that information. So I did not share that information, and happy to report I have not stolen another cent, not even a stamp from any of my workplaces since. But that's an example of how self-disclosure can diminish trust. So we're going to talk through some boundary scenarios and to practice thinking about, how we would respond in these situations if boundaries are crossed. So scenario one here is about the phone boundaries. So I'm going to read this prompt, and then you all let me know in the chat how you would respond to this. Your participant is going through a challenging time and has been calling you after hours on your work phone. You picked up once and they thanked you, saying that they would have used if you didn't pick up. Since then, they continue to call. How do we respond to this participant? Great, thank you. Encourage them to build their recovery network, maybe at support meetings. Yes, you can't be the only person that they're calling, the only help that they have. And exactly, use as an opportunity to discuss cultivating social capital. Yeah, to help grow their support network. That's excellent. And this has been an interesting one because sometimes peers say that there are no boundary issues here, that they always want to be available, that they, think back to those porous boundaries where, I just always want to be available. Some people have no one. I just always want to help. Those kinds of porous boundaries is what will lead to burnout and passion fatigue really quickly. So going that extra mile blurs those lines, and you just can't be everything to everyone. And this is a good opportunity to link the participant to other resources to strengthen their support. Maybe it's getting a sponsor, going through support meetings. Make sure they have crisis line numbers. Do they have the 988 crisis line number? And you have to remember your role, and you may have to remind the participant of what your role is, that you are a peer support, you're not their family member, and that your job has designated work hours and you're not expected to use a personal phone or take after hours calls. And so, drawing that boundary and having that conversation, like, I know I answered that one time, but I cannot do that going forward. My shift is over at 6 p.m. and my phone's off after that. So who else can you call? And then work with them to build that support network from there. So scenario number 2 is about social media. Let's say that you start working with a new participant and realize you know them from the past and that you were friends with them on Facebook prior to working with them. So what do you do? Do you keep being friends with them on Facebook? How would you address this situation? Yeah, that's right, Patrick. It does depend on organizational policy. And connecting on social media, it's a controversial topic. And this is one of those things that if your organization has a policy, I think that's the easiest for people, because it's easy to share the blame, on the company policy. Where I went to treatment, those peer support specialists could not be friends with the clients on social media for 2 years, after being released. So it was really easy for them, when someone would ask, like, hey, can I friend you on Facebook when I get out of here? And they're like, no, it's a 2-year policy. Very, very simple for them. But lots of places, such as Voices of Hope, does not have a social media policy. And so it's this controversial gray area where we leave it up to the employees to decide for themselves what their boundary is and how they want to handle these social media issues. So this is where you have to do that self-reflection, and you have to know what feels safe for you. What are your lines and limits with this? And so there's things to consider. What is your prior relationship with the participant? What are the risks and benefits of connecting with them on social media? Are there potential safety risks prior to interacting with any client on social media? Opportunity to discuss HIPAA compliance. Yes. I mean, and are we getting into some really legally tricky territory by connecting on social media, with our participants, with our clients, where we're not supposed to, confirm or deny that they are a participant of ours. And remember that what you post, back to the, is it safe, potential safety risks, do you want them to have access to you? Do you want them to, see that you're going on vacation or see pictures of your children? Do you want them to have access to that personal information? And so there's some tips here. If your company does not have a policy, you could set your account to private, give people limited viewing access, hide your friend list. You could make a work only Facebook account that is, very minimal information that you just use for professional purposes. And if you're working with someone and they will only communicate through social media, does your agency have a social media account that they could, they could message or they could reach out to? Just something to consider. And I like this last tip here. Consider setting one standard boundary for all participants. I'm not friends with any of my participants on social media. So in this scenario, it's like, so I'm going to have to unfriend you. Please don't take it personally. This is just, what I do. I'm not friends with any participants. And that avoids the playing favorites. Because if you're friends with one person on social media, but, one participant, but not the others, how is that making the other participants feel? Is this kind of creating some, unnecessary favoritism that could be impacting the services that they receive? And also, you just deserve a personal life. I think that's also worth underlining because, as peers, people working in recovery, we are expected to share our stories and our, lived experience and our vulnerability every day. And I think we can forget that it's okay for us to have a private life. All right, so scenario 3. It's about exchanging money or goods. You had a great interaction with a client today and you feel like you are making progress. The client leaves, but returns shortly after because they are still waiting on their ride. They catch you on a smoke break and ask if you can have a cigarette. So what would you do? Are you going to give your participant a cigarette? Or $1 for the bus could be another alternative, because I'm hearing more and more people are not smoking cigarettes. Well, I think this is the scenario that when I give this in trainings, most people tell on themselves that they have done this. They have given a cigarette or $1 for the bus. Oh, thanks, Leah. If they ask for money for the bus, I would say I don't have cash or I'm not allowed to give it out to clients. Yes, because this could be grounds for disciplinary action, for giving out things that you're goods, money, that you're not supposed to. Yeah, outside of what might be available at the agency, because exchanging money or goods changes relationships, changes how people think of one another, as well as the power dynamics. And I've heard people share, that they've learned this lesson the hard way, that they, gave someone a cigarette and then suddenly everyone was asking them for a cigarette. And, you shouldn't give one if you can't give one to all. I've heard that come up too. And it can damage the integrity of the relationship. Also, this can get into the playing favorites, and just can really open the door to more issues. So what can you do instead? Can you give them a cup of coffee? Does your agency keep snacks, available that you can give out? Do you have barrier relief funds? Do you have bus passes? Just what are the other options? I will say, one instance of a coach giving out gifts essentially that I thought was really clever was a coach at an SSP who was really struggling to connect with the participants there. And what she bought a bunch of stickers, and she had a bowl of stickers on her desk, and she would ask the participants to pick out a sticker, and then based on the sticker they chose, she would start a conversation with them. And I thought that was a very clever use of being able to offer someone a quote unquote gift that didn't cross any boundaries, also because there were stickers available for everyone. And it really helped her connect with the people there in a way that felt safe and was within the organizational policy. Looking at the time here, I'm going to go through this next one pretty quickly, this intimate relationship boundaries. You have been working with a client for the past few months and have developed a strong working relationship. One day, the participant begins to make comments towards you that are sexual in nature. So do not engage. That's the short answer, is do not engage in any sexual behavior, activity, flirting, nothing with a participant. It is unethical, inappropriate, and the relationship between a peer support and participant, it's not of equal power. These participants are vulnerable and are coming to us for help. And even if they are the one that makes the comment first, you do not have any permission to act on that. It's very damaging, creates loss of trust, can damage recovery outcomes for both the coach and the participant. Thanks, Patrick. Hard no. Thank you. Discuss with your clinical supervisor. Yes. You have to tell someone when this happens. And I think, I've done this training a lot, and I've had discussions about this scenario a lot. And some people can just very confidently say that they've had these experiences, and they shut it down in the moment, and they say, no, that is not appropriate. You cannot talk to me like that. And they're able to do that. But some people cannot. Some people freeze. Some people, can't have that conversation, can't find the words right away. They might laugh it off in the moment until the moment passes. And those different reactions are trauma responses: the flight, fight, freeze, fawning. So, and we don't get to choose which reaction that we're going to have in that moment. That's all happening, between the brain and body's having a whole reaction. And so if you freeze in the moment, or if you fawn in the moment and you're like, you just kind of laugh it off, like, I don't want you to be too hard on yourself, that you can confront them in the moment. Because we just don't have a say over our trauma responses. But go to your supervisor and have this discussion with the participant. This boundary line has to be drawn. And it could be that maybe they need to see a different recovery coach. And, maybe your organization has a policy on, if something like this happens, how these things are addressed. And this last comment here on this slide, It is not uncommon for professionals who work closely with clients to develop feelings of attraction, but acting upon them is unethical. So if you are working with a participant and you have a thought that, you know, this person is attractive to me, and you just have the thought, you're not in trouble for a thought. Thoughts just generate automatically. It's acting on them. That's unethical. So just because you have the thought, that just happens sometimes as a nature of being a human in society, but do not act on it. Like Patrick said, hard no. And communicate with your supervisor. So this is the last scenario, the supervisor boundary. And this one's interesting. I've also heard a lot of different stories related to this one. Okay, in this scenario, you have been working at a Suboxone clinic for 2 weeks when the urine collector technician quits on the spot. Your supervisor asks you to help and collect samples until they can hire a new technician. 3 months later, they are not hiring for a replacement technician, and your supervisor says, "I don't know what I would do without you." So what do we do when our supervisor is asking us to do something that is not in the job description, crosses a workplace boundary? What do we do in this scenario? Train me or find someone else. Thanks, Patrick. Well, Patrick, I like that you're, solution oriented here, you know, um, and providing options. And what's interesting about this scenario is I will hear sometimes recovery coaches will say, Leah says, ask for a pay increase for more job duties. Yes, that's a possibility. But I will hear coaches say in training, oh, I would never be caught in this situation. That would never be me. I would never agree to that in the first place. And I really want to challenge that. If you're listening today and you're thinking, oh, that could not be me. I think this happens a lot, especially people who are, in recovery and you just, gosh, you want a job. You're so grateful for a second chance, another chance, and you don't want to be seen as difficult. You want to be a team player. You don't want to jeopardize, this financial security. And so you agree because you also want to be helpful. Maybe you're service oriented, whatever. But I think that this happens a lot. And that's the feedback I've gotten when I've done this training at Voices of Hope and outside of Voices of Hope. And really, this leads to you needing to have a conversation with your supervisor. That's what has to happen. If you're in this situation, you're uncomfortable, you're not okay with whatever's going on in the workplace, you got to have that conversation. And it's really important that when you have that conversation, you follow it up with an email that summarizes the conversation. You want to include important details that were discussed, and this creates proof of the conversation. If you don't document it, it didn't exist, is the sentiment here. Because if you're just kind of in passing, saying you have a problem with something, there's just no proof that you ever talked. And so an email is your timestamp proof that you had that conversation. And if you feel unsafe with your supervisor, does your organization have a human resources representative? Does your organization have a whistleblower policy? Check the employee handbook to see if there could already be a system in place for voicing major concerns. And so that's something to consider. So having these conversations leads us into self-advocacy, which means speaking up for yourself. How do I speak up for myself? Self-advocacy is the action of representing oneself or one's views or interests. And this can be really tough, especially in the workplace, especially going to your supervisor, especially when you've got, your financial security's on the line. And yeah, it's just very challenging. But we're going to talk through the steps for self-advocacy and how to have these conversations, how to speak up for yourself. So step one, you've got to gain clarity about the situation. You've identified a problem in the workplace or difficult emotion within yourself, and you have to be able to name it specifically. So the vibes are off at work is not specific, versus I don't know how to remove myself from office gossip. That is specific. I don't want to do that, not specific, versus this task is outside of my job description. And so you have to know your values, your goals, your needs. And if you're not clear on what the problem is, then you will not be able to communicate the problem clearly. And so you've gained this clarity, you know what it is specifically, what the issue is. And then the next step is to communicate it effectively. And I'm going to review communication styles on the next slide. But what we're aiming for is assertive, respectful communication with the correct person. This is not gossiping with the person next to you at work. That's not going to change anything. But going to the right person, the correct person, your supervisor, and having this respectful communication about the issue you've identified. Then, like I said before, document the conversation. And here's just a very simple template for how to write that email. Thank you for your time today to discuss my concerns about blank. It is my understanding that the next steps are blank. And now you've documented, you've got this proof that the conversation happened. So you've got the clarity, you've communicated the issue, and then the next step is to embrace solutions. You got to, on one hand, prepare ideas to solve the problem. Or if you don't have ideas, you're not sure how to solve the problem, be willing to collaborate, to find the solutions, be open-minded to solutions. And then prepare yourself to adapt to new circumstances. It could be that they, agree with you and they change things, and that's wonderful. It could be that the supervisor says, no way, we're not hiring anybody. It's not in the budget. So, you just need to keep doing it. Okay, well, now you have new information that no matter what, they're not going to make a change. And then you need to reevaluate based on whatever the solution is, whatever the feedback is that you get. So I'm going to walk through these different communication styles. I know there's a lot happening on this slide. And some of these we kind of touched on earlier, talking about the porous, healthy, and rigid boundaries. So we're going to start here on the left-hand column about passive communicators. And so passive communicators, they are the ones that are just, it's okay, whatever you want to do, the I don't care, whatever you want is fine, those types of people, the people pleaser types. And it gets points for being respectful and appropriate, and can be the safest option when we're trying to de-escalate a situation, de-escalate from violence, but it's dishonest, it's indirect, because the person is not advocating for their own needs. They're not honestly sharing, what's important to them, which can lead to this communicator to have built up anger and just this sense of like, no one understands me. And it's because you're not sharing what you really care about. You're being passive. The next one is passive aggressive. And there are no good qualities for those passive aggressive communicators. And this can look a few different ways. On the surface, it appears as passive as, going along with, being happy to participate in whatever the situation is. Everything's fine. But then underneath, it's aggressive, which could be even like sabotaging someone else's work efforts. It could be spreading rumors, giving the silent treatment, or sarcasm. That's the one where I'm totally guilty of sarcasm. That's my passive aggressive trait that also I'm not proud of. I'm work in progress here. It's disrespectful, it's inappropriate, and no one's needs are getting met here. Then the aggressive communicator does get points for being honest and direct, but they're disrespectful, inappropriate, just ignoring the rights and feelings and ideas of other people. And this is the my way or the highway type. This is what we're going to do. Get over it. They can have aggressive body language, aggressive posture, and their needs are the most important. And this leads to people feeling hurt and feeling alienated. So what we're aiming for here is assertive communication. Those are those I statements. I feel, I need. You're making, eye contact. You have relaxed body language, and it's honest, direct, respectful, appropriate. Not the most effective when someone's threatening your safety. That's when it's good to default to the passive communication. The needs of everyone in the conversation is equal. One of the downsides, though, is that it may be misinterpreted as aggressive, especially for women, people of color. Like if they just make an assertive statement, when we've been socialized, like when women have been socialized to just agree all the time, to be selfless. And so when a woman makes a statement that's assertive, it can get misinterpreted as aggressive. And that's a consequence of just our kind of how the cake is made socially here, and just our expectations of women. But I want to tell just a quick story. I'm looking at the time. I know we're winding down here in the few minutes, and I've only got one slide left after this. But I had a job early in recovery, and I was in that situation where I was just so grateful to have the job, and but the workload was very intense. And so I was an hourly employee, and I started coming in 30 minutes early to just try to get ahead of the day, get a grip on what I needed to do. And very quickly, I started staying in a half an hour late to just try to get work done, try to get caught up. And so very quickly, I was working 5 hours a week overtime that I was not claiming on my paycheck. And I was just waiting for my supervisor to notice, that they would notice how much I was working. And I started to feel like this is so unfair. Don't they see how hard I'm working? And I can't believe, that I'm not getting paid overtime for this. And so I started doing the passive aggressive thing, and I started making some sarcastic comments. I said things like, wow, this job sure is like taking a sip off a fire hose. And my boss, laughed at that. And I was just waiting for things to change. And I made another comment, like, if we're going to pretend that I only worked 40 hours a week, then I need to leave at 3:00 on Friday. And my boss said, oh, that's fine. Yeah, you can leave early. When really I should have left at like 10 a.m. because I already was at the 40-hour mark. Again, I wasn't being honest, wasn't being forthcoming. And this resentment was just starting to build up, this built up anger and frustration and feeling like no one sees what I'm doing here. And I realized I was not communicating assertively at all. I was expecting my boss to read my mind. And so I finally said to my boss, I'm averaging 5 hours of overtime a week. Can I claim that on my time card? And she said, absolutely. Yes, please claim the time and give me a list of tasks that you're doing that could be given to someone else. So that way you're not so overwhelmed. I was amazed. I'm so grateful that that's how she responded. This is the best, case scenario for a situation like this. But it was so important for me to realize that I had been passive aggressive, and that wasn't getting me anywhere. And it was that assertive communication that then opened the door to solutions. And now what if she had said, no way, no one asked you to work extra. You're doing that to yourself. This is trouble of your own making. Well, that would have been new information. I would have had to reevaluate my goals at that point, if that had been the case. So just a few additional tips. Develop your confidence. There's no shortcuts to this. This takes time, self-reflection. Find your teachers. Who can you trust for guidance and advice? Be willing to learn from everyone you meet, and manage your expectations. What's your job? What's your expectation at work? What does your supervisor expect from you? You can't expect your organization to just change everything to meet your own values. So make sure your expectations are in the right place. I just want to empower you to please care for yourself, to echo the self-care part from the beginning of this presentation. Put the oxygen mask on yourself first. And I love this. I want you to have the best of me, not the rest of me. And don't set yourself on fire to keep others warm, which is one that I see a lot. People just give and give and give and totally deplete themselves. So be mindful of that. Avoid that burnout if you can. And this is truly the last slide. Please work on the relationship with yourself, because it is the longest relationship that you're going to have. And here is QR code for a quick evaluation. And at the end of it, you'll be given an option to receive a certificate for continuing education credit if you are a peer support. And Leah just also put that link in the chat. Thank you so much, Leah. And if you have questions, or you want to request this training, or you want to, reach me, there's my email. Happy to hear from you and answer any questions you have.
So Brooke, this is Mary Beth. I just wanted to take a minute in closing Emily and I are so grateful for you joining us and hosting this webinar for our bridge programs today. I think the information you shared and, your personal examples really made it engaging and informative for our group. So we're very grateful, and we truly appreciate you giving your time up to join us. We would like to remind all participants that the webinar was recorded today, and it will be shared on the SOS website in the coming days. We will also be sharing a link when it's ready for your viewing. We do have a webinar coming up in February that we wanted to make you aware of. We have Jim Kauser returning. He presented back in November, and he's going to be coming back and talking to the bridge programs about medications for opioid use disorder and negative bias. So that will be on Tuesday, February 10th at 11 a.m. Eastern. That Teams meeting invite will be shared in the coming days. So we just wanted to go ahead and announce that while we had the group together. And in closing again, Brooke, we really thank you for joining us and for making this, webinar so engaging, and for sharing all of your insights with all of us. So if anybody has any follow-up questions, please feel free to reach out to Brooke on the email provided. And I don't see anything. I'll check the chat box. Yes, and Brooke, Pat just shared, thank you for doing this today, and great job on the presentation. And I wanted to make sure nothing else had come in the chat box. Emily has also shared information as far as emailing. So we will go ahead and conclude this session. And thank you again, everybody, for joining us. And Brooke, many thanks for leading our webinar today.
Thank you for having me.
Have a good day, everyone.
Thank you.